Knock, knock, knock. Hi, my name's Lisa. I'm going to be your student nurse today. How are you?
Good, how are you?
Good. I'm going to provide privacy for my patient, do hand hygiene, sanitize my stethoscope. Can I please have your name and date of birth, sir?
Christopher Patterson, 12/31/98.
Perfect. Can I see your wristband? Great, thank you so much. I got an order to do a neurological exam, a musculoskeletal exam, a head, eyes, ears, nose, and throat exam, cardiac and respiratory exam. Is it okay if I do that today?
Yes.
Perfect. Can you tell me the year it is?
2025.
Okay, can you tell me who the president is?
Donald Trump.
Perfect. Can you tell me where you are?
The doctor's office.
All right, and can you tell me why you're here?
For an exam.
Perfect. So we're going to get started. We're going to go ahead and do your head, eyes, ears, nose, and throat. I'm just going to examine your head. Right. Your head looks symmetrical. I'm not feeling any knots, lesions, bumps. Not seeing any bruises. Have you had any procedures on your head?
No.
Okay. Do you ever get headaches?
Sometimes.
Okay. What does that feel like?
Just kind of like tension or like a rubber band around my head.
Okay. And how often?
Probably once or twice a week, perhaps.
Okay. Okay. I'll definitely get that noted. I'm gonna look at your ears. It looks good. Making sure both auricles line up with the eye. This one does. I'm not seeing any bumps, lesions. Ears look normal. Do you have any problem hearing?
No.
Okay. Do you have any hearing aids?
No.
Okay. Next, I'm going to assess your eyes. Before I'm gonna have you take off your hat, sir, so I can see your pupils. We're going to do a curl exam. So I'm going to assess your pupils. I'm going to see how round they are, how they react to light, the equality. When I use my pen light here to shine the light in your eyes, I'm going to see how the pupils constrict with direct light and how the other pupil constricts with, which is called consensual constriction when the light's not directly in the eye. So, do you wear glasses? Do you wear glasses?
I do.
Okay. And do you have any problems with your vision?
No.
Okay. Any blurriness?
No.
Okay. So let me see what your pupil size is here. It's supposed to be between 1 and 7, and yours looks like it's about a 5. So that's within normal limits. So I'm going to shine my light within this eye. So I see that they both constrict. Now I'm going to shine my light within this eye, and they're both constricting again. Next, I'm going to test your nose. So do you ever have any problems with your smell?
No.
Do you ever have any problems breathing through your nose?
No.
Okay. I'm going to have you cover one side of your nose and breathe. Okay, is that okay?
Yes.
And I'm going to have you cover the other side. Okay. And next, I'm going to look into your mouth. Can you smile for me? Can you smile? Thank you. Perfect. Your lips and your gums were pink. I noticed that your teeth in your mouth had normal secretion, and I didn't notice any missing teeth, so it looked like your hygiene was well. Do you wear any dentures?
No.
And have any problems with your teeth?
No.
Okay. Next, I'm going to assess your throat. So I'm going to feel as you swallow. Perfect. Do you have any difficulty swallowing?
No.
Okay. Next, we're going to test your muscles. So I'm going to test the mobility and range of motion of your elbow. Do you ever have any problems with your range of motion?
No.
Okay. And do you ever have any pain in your joints, muscles, or anything?
No.
Okay. So we are going to, right now we're extended. And now I'm just gonna have you bring it in for flexion and then back to extension. So now we're gonna try with resistance. So I'm just gonna provide a little bit of restraint and you'll still try to flex, okay? Perfect, and now try to extend. Perfect, does that feel okay? Any pain?
No.
Now we're gonna do the other arm. So we're going to flex, and now we're going to extend, and now we're going to do that with resistance. Perfect, and now try to, perfect. Okay, and so now we're going to do the same thing with the wrist. We're going to extend, oh sorry, just regular, so that's extension. And now you're gonna bring it down for flexion with me supporting the joint, back to extension, and then hyperextension. Does that feel okay?
Yes.
Okay, so now we're gonna do it with resistance, so go ahead and flex, extend, perfect, and then hyperextend. Perfect, does that feel okay?
Yes.
Okay, so now we're going to do the other wrist. So right now we're at extension with me supporting your joint, and so now you can flex, extend, and then hyperextend. And so now we're going to do it with resistance, so go ahead and go back down, and then flex down, perfect, and now we're gonna go back up to hyperextension. Perfect, was that okay?
Yes.
Alright, so now we're going to do your leg, so I'm going to assess your knee. So right now you are flexed, we're going to extend, and now back to flex, and now we're gonna try resistance, so, okay, now you can come back down and try to flex. Does that feel okay?
Yes.
Alright. And so now we're going to do the same thing with this leg. You can go ahead and extend. And now flex. Okay, and so now we're going to try resistance. So extend. Perfect. And flex. Perfect. And so now we're going to assess the range of motion within your ankle. So we can start with this one. So we're going to plantar flex, dorsiflex. Sorry, you got something between your toes. Dorsiflex. Perfect. And now we're gonna try with resistance. So try to plantar flex. Perfect. And dorsiflex. Perfect. Does that feel okay?
Yes.
Okay. So now we're going to plantar flex and then dorsiflex just by pointing your toes. And now we're gonna try with resistance. So you're going to plantar flex and now dorsiflex. Perfect. Great job. With your neurological exam, everything seemed perfect. You're dressed appropriately. I'm not noticing any skin lesions, odor. Everything seems symmetrical. So now we're going to go ahead and go into our respiratory exam. So when I was examining you, I noticed that you were breathing appropriately. Your chest walls were moving bilaterally. So now I'm just going to palpate to make sure you're breathing appropriately. Perfect. My thumbs are moving out and up, which is what they're supposed to do. Do you ever have any shortness of breath?
Sometimes.
Okay. How often?
Randomly, so maybe once a day.
Okay. What are you doing when you typically feel shortness of breath?
Working out.
Okay. I will definitely get that noted and let the provider know. You go ahead and assess. And are you on any medications for your respiratory?
No.
Okay. So if you feel any pain or discomfort, let me know. You'll just breathe in and out normally through your mouth, okay?
Okay.
And now I'm just going to have you rotate, sir, so I can listen to you posteriorly. I'm just going to watch the patient breathe. Okay, everything seems fine. And so now I'm just going to feel. My thumbs are moving up and out as he's breathing, which is what they're supposed to do. I just want you to breathe in and out through your mouth the same way, but take deep breaths. If you feel lightheaded at all, please let me know.
Okay.
I'm going to move 3 inches out. I'm going to listen out. Okay. Everything sounds great. Respirations are even. Okay, so now we're going to, that was your respiratory exam, so now we're going to do your cardiac exam. So for this exam, I want to make sure my client is at a 30-degree angle. Sir, if you'll look to the left. Perfect. And now if you'll look to the right. Okay, I don't notice any jugular distension. So now I'm going to check skin turgor. And the skin went back immediately. Now I'm going to check capillary refill. And the nails turn pink immediately, so that's good. Now I'm going to check for temperature. His skin feels appropriate, no heat radiation. And now I'm going to check for edema. No signs of edema. I'm going to check the lower limbs for edema. You're good. No edema. So now I'm going to start palpating the arteries. I'm going to feel the carotid. Don't want to feel both carotids at the same time. Or occlude both carotids at the same time. That's 2+. Let me know if you feel any pain or discomfort, okay? 2+ as well. And now I'm going to feel the axillary underneath the armpit, or attempt to. I feel it. Excuse me. I'm going to attempt to feel this axillary artery as well. Perfect. And now I'm going to feel your brachial. I would say that's 2+. Oh, sorry. 2+ as well. And now I will fill your radial artery.